everyone, and welcome back to Medigap Show. I'm your host, Holly Cohen. I want to go over a few things for this annual enrollment period that we are currently in for 2024. I'm going to go over 5 Medicare mistakes. But before we dive into this, I want to explain what this Medicare annual enrollment time is for. Medicare annual enrollment period, which is October 15th through December 7th, is for people who are on a Medicare Advantage plan and either want to change to a different Medicare Advantage plan or want to go back to original Medicare. Or if you're on original Medicare and you have a Medigap plan, it's also the time that you can change your Part D drug plan for 2024. This is that period. The people that have original Medicare with a Medicare supplement, also called Medigap, which is identified by a letter F, a letter G, or a letter N, do not need to make changes this time of year. You can if you'd like to, but the rule is if you're on a Plan F, a Plan G, or a Plan N, or any variation of that, a Medigap plan is what I'm talking about. You are allowed to make changes to that any time of year, meaning you can switch from one to another. But if you've had Medicare Part B for more than 6 months and you're 65 years of age or older, then you would have to go through medical underwriting questions to change your Medigap plan. But you can do that any time of year. It does not have to be right now. If you want to, you can. But most of the hype, 90% of the hype that you're seeing on all the major news networks, and believe me, I'm watching the news right now as well with 2 wars and a presidential election coming up next year. There are a lot of people watching the news, and all of the lead generators, the people out there trying to get you as a Medicare beneficiary to call in, 90% of them are trying to get you to go onto a Medicare Advantage plan, or if you have a Medicare Advantage plan, to choose a new one for next year. That's what 90% of those commercials and anything you're reading online mostly is about. The other 10% is related to people who have original Medicare and want to maybe change their Part D plan. If you watch these commercials, they're just crazy because they're saying all people on Medicare, and it's not the truth. They're not telling you the truth. It's not all people on Medicare. People on original Medicare who want to keep original Medicare do not need to call that number because they're going to try to get you to switch to a Medicare Advantage plan, which takes you off of original Medicare and puts you on a network PPO or HMO plan that would have prior authorizations for medical treatment and have unexpected medical costs and max out of pockets. When you're on original Medicare, you're on the real federal Medicare program, which pays 80% of your bills, and a Medigap plan fills in the gap and pays the 20% and pays all deductibles of Part A if you're on an F, G, or N. And then if you're on an F, the deductible of Part B is paid for. If you're on a G plan, the deductible of $240 for next year would be your responsibility. But either of these, they keep you on original Medicare. Let's dive right into what our topic is today, the top 5 Medicare mistakes that you can make during this Medicare annual enrollment period. Our phones are ringing like crazy. We're helping our current clients and helping you. We're more than happy to help. It's all about making the right decisions. So let's just get down to business and discuss these common pitfalls that people make this time of year. Mistake number 1 is neglecting that annual checkup for your Part D drug prescription plan. Prescription plans, also known as Part D, can shift. It's important that you double check that every year to see what the new plan for Part D, as in drug, is for the following year. You can do that by either calling an agent like myself, or you can go online to Medicare.gov, or you can call Medicare at 1-800-633-4227. And remember, we're always here to make sure that you're not spending a penny more than you need to. So let's talk about why this yearly check-in is your ticket to savings and peace of mind. Mistake number 2 is clinging to those familiar grandfathered plans like Plan F, when the other option, which is Plan G or Plan N, may be a better fit for your needs. So now let's discuss why it's essential to not get left behind in this ever-evolving world of Medicare supplement plans, Medigap. If you're on a grandfathered plan, which would be a Plan J, a Plan F, or a Plan C, those plans have been grandfathered. Plan F and Plan C, if you had Part A of Medicare prior to January 1st of 2020, you are eligible for Plan F or Plan C, but it's not going to be cost effective, typically. So you would want to look at Plan G or Plan N, which are going to be much more cost effective, and you can apply with any of the Medigap carriers to see if you qualify. Remember, rule of thumb is if you've had Medicare Part B for more than 6 months and you are 65 years of age or older, any insurance company that you try to enroll with for a Plan F, G, N, any of the Medigap letters, you will have to go through medical underwriting and either be approved or declined based on your health status. Medicare mistake number 3 that you can make during this annual open enrollment period is the cost of your Medigap plan. If you have great health, you can explore other insurance carriers that have the exact same letter as you. So if you have a Plan F, you can switch to another Plan F if you want to. It may not make financial sense because typically a Plan F is $50 to $60 higher than a Plan G. And the only difference is between a Plan F and a Plan G is the Part B, as in boy, deductible for 2024, which will equal $240. So you may be overspending for your Plan F, or if you're grandfathered also on a Plan C. And you would want to look at Plan G to try to save money. Medicare mistake number 4, switching to a Medicare Advantage plan without a thorough understanding of the process. I'm here to provide you a roadmap to get back to Medigap if you did switch to Medicare Advantage last year or recently and didn't understand why or how that even happened to you, because it's not your fault, by the way. There are lots of call centers that call very innocent Medicare beneficiaries, or the very innocent Medicare beneficiary can go on the television and call the phone number on their screen and then wind up on a Medicare Advantage plan. Medicare mistake number 5 is not knowing what you are on and not knowing what you are moving on to. So it's very important to understand what you currently have, if it's exactly what you want for your Medicare, whether it be Medicare Advantage or whether it be original Medicare with a Medigap plan. It's so important to understand that there are 2 different and distinct ways to be on Medicare, and there are lots of call centers, especially this time of year, that are predatory, and they are trying to switch you off of original Medicare onto a Medicare Advantage plan. If this has already happened to you over the last few years, this is the time of year that you can switch back to original Medicare and re-enroll in a Medigap plan, or enroll for the first time in a Medigap plan. And if you've had Medicare Part B for more than 6 months and you're over 65 years of age, you will have to go through the medical underwriting with all the carriers. One last thing, Part D for next year. If you're on an expensive one and you're feeling that it's not covering your medications well, it is so important, and I know I said it earlier, but to make sure that you do a Part D plan review. If you're on original Medicare with a Medigap plan and you have a standalone Part D, and I'm saying this because there is a $0 Part D Medicare plan for next year. a Part D standalone Medicare plan for 2024 costing $0 in most states. Other states, I've seen it for 50 cents. And it does cover many generic medications very, very well. It saved people who were on a grandfathered older Part D plan, a drug plan that maybe is no longer sold to new people. That happens. So that's why it's always important to assess and check your Part D every year. There are people who are on a plan from a few years ago that now would be paying $40 for that same Part D for next year, when there is actually a $0 Part D plan for 2024 that covers the medications just as well as that one that you might be stuck on that was going up to $40 for next year. So this is the time to review that. You can give us a call, 855-265-6334. Go on our site, medigapcares.org. You can schedule your free consultation, free Medicare review, or you can also call Medicare at 1-800-MEDICARE, 1-800-633-4227. That's all for today. I hope I gave you some real valuable information. If you like what I shared, please hit the like button. Know that we are doing our very best to get all information out there regarding Medicare for next year. You can also share this with your friends so that everyone knows what's going on with Medicare for next year. Thank you so much for joining me today on Medigap Show. This is Holly Cohen, and as always, be well.